Our current challenges are not just straining the system, they're putting lives at risk.
For several years now, the need for better EMS support in Minnesota has been clear. In 2024, advocates in St. Paul pushed for $115 million in funding, money that at the time would have covered the state's total deficits of EMS departments.
Roughly half of that was operational deficit, the other half was what volunteers were contributing to the system.
But the system as it stands is bleeding money, so to speak. High operational costs mean that most, if not all, departments operate at a net deficit. This year, they're looking to not only put a Band-Aid on the issue, but to stop the bleeding long term.
We're putting forward a package of sustainable EMS funding for our rural services to ensure that the state is stepping up and saying this is a moral imperative.
A new bill would seek roughly $50 million each year for EMS funding. Advocates are also proposing an increase to Medicaid reimbursement, which would put more on EMS's bottom line. It's not a perfect solution, but it's a step in the right direction. According to experts, the imbalances disproportionately impact rural communities.
This won't completely offset the tax burden and stuff that's out there throughout the state. And these numbers really are coming primarily from rural services. So this is the areas where their volume does not generate enough revenue coming in for them to even self-sustain.
But with a projected deficit 4 years out, attention this year has fallen on spending reductions, not increases. Advocates at the Capitol say despite a tighter budget this year, they're lasered in on an EMS solution.
We have a target that cut money from health, both in the front and in the tails, but that's my focus.
Reporting in St. Paul, I'm Quinn Gorham.